Good day, viewers. My name is Dr. Kenda Botari Ken. This is Doctor Perspective on Maxi Health. Today we'll be discussing another topic on breast cancer called young women and breast cancer. Young women today lack this strong education on breast cancer, which has led to late diagnosis of the same breast cancer. Now, what are we doing about that? We should start from their mother. Mothers should always guide their children when it comes to breast cancer, especially their teenage children, because it is also important when a young child is being empowered with breast cancer knowledge. It is very difficult for them not to perform their breast self-examination, not to go for their clinical breast self-examination, and not to live a healthy life that can also help their health. So, mothers have a strong role to play, but the point is, are also mothers breast aware? Are also mothers knowledgeable on breast cancer? It is important for young women today to be empowered with any myths on breast cancer. Today, about 30% of breast cancer on young women are extremely aggressive. Scientifically, they are even making us to understand that there is a difference between the breast cancer on a woman of age 40 and above, or 50 and above, and a woman breast cancer of age 40 below. There are two different kinds of cancers because one, a younger woman who suffered from breast cancer, definitely their cancer is always aggressive and also recurrent. It is also important for a woman to be knowledgeable on the ways on how to detect this disease early. Just as we keep on saying, being breast aware, to do their breast self-examination, to perform their clinical breast self-examination. But how can this be done? We have some answers and guide to young women today. So we'll be discussing about 5 guides and advice, which you can put it in that way, on breast cancer. Becoming familiar with the look of your breast offers the best chance for a young woman to notice any change. It is important for a woman to do their monthly breast self-examination. Monthly breast self-examination is very important and should be performed 4 days after their menstrual cycle. Early detection does not necessarily depend on expensive diagnostics equipment. Clinical breast self-examination by your doctor can help diagnose more cases earlier. So it is very important for young women to visit their doctor in case they find anything unusual in their breasts. Dietary changes, nutritional supplements, and good lifestyle changes can decrease a woman's risk of developing breast cancer. That means our food intake, what we eat, is very important. They can also increase our chances of developing breast cancer. Sensible talking about breast cancer to make it less frightening and to empower your daughter to be proactive about our breast health can also help. The way you approach your daughter about breast cancer will influence her thoughts and feeling about the disease. Know your girls. So these are few guides and advice which we can give you for today. As we always say, we fight breast cancer before it starts. Today we have been talking about young women and breast cancer, and likewise parental guide for breast cancer. So stay tuned and don't go nowhere. Maxi Health continue.